Gentlemen, let me ask you something directly, and I want you to answer honestly, even if it's just in your own mind. When you wake up in the morning now, do you feel the same sense of drive, clarity, and quiet strength you felt in your 30s? Or does it feel like something has slowly dimmed over the years, not all at once, but gradually enough that you almost started to accept it as normal? What if I told you that something incredibly simple, something that takes less than a minute before bed, could support your body's testosterone signaling in a way most men are never told about? I know. It sounds like one of those internet gimmicks or late night promises. Stick with me for a few minutes, because this is not magic, it's biology. And once you understand the logic, it will make sense in a very grounded, almost obvious way. My name is Dr. Lina. I am a board-certified medical doctor and urologist, and for well over a decade, I've worked almost exclusively with men over the age of 45. Every single day in my clinic, I sit across from men who are doing their best to age with dignity. They're not looking for shortcuts or fantasies. They want to feel like themselves again. And one of the most common frustrations I hear is this quiet sense of loss. Not just libido, but motivation, muscle tone, recovery, sleep quality, mental sharpness. Testosterone is part of that conversation, yet what surprises most men is how rarely anyone explains what really affects it, especially after 50. There are simple, overlooked factors that never come up in rushed appointments, and that's what I want to talk to you about today. Here's the truth that rarely gets said out loud. The male body begins to change much earlier than most men realize. After your early 30s, testosterone production starts to decline very gradually. By your 40s and 50s, that decline becomes more noticeable, especially when combined with stress, poor sleep, inflammation, and reduced nutrient absorption. Blood vessels become a bit stiffer. Muscles, including the deep muscles of the pelvis, hold more tension. The prostate may enlarge slightly. Sleep becomes lighter and more fragmented. None of this means something is wrong with you. It doesn't mean you're broken. It means you're human, and you're aging in a modern world that doesn't support male biology very well. One of the biggest misconceptions I see is the idea that male performance and vitality are purely about hormone levels on a lab report. Testosterone matters, yes, but it does not work in isolation. Your body's response to testosterone depends on blood flow, on muscle tone and relaxation, and on nerve signaling. These systems are deeply interconnected. You can have a normal testosterone number and still feel flat, tired, and disconnected from your body. The good news, and this is important, is that all of these systems remain responsive well into later life. The body does not shut down its ability to adapt just because you've crossed a birthday. Now let's talk about something simple and often misunderstood: micronutrients. As men age, the gut becomes less efficient at absorbing certain vitamins and minerals. Medications, stress hormones, and inflammation all interfere with absorption. One nutrient in particular plays a quiet but powerful role in testosterone signaling: sleep quality, nerve health, and muscle relaxation. That nutrient is vitamin D3. And before you tune out because you think you've heard this before, stay with me, because the way you take it matters more than most men realize. Vitamin D is not just a vitamin, it functions more like a hormone in the body. Testosterone-producing cells in the testes have vitamin D receptors. So do muscle cells, blood vessels, and areas of the brain involved in mood and motivation. Yet after 50, many men are functionally deficient, even if they live in sunny climates. Why? Because aging skin produces less vitamin D from sunlight, and aging digestion absorbs less from food. Swallowing a pill and hoping for the best is not always enough. This is where the sublingual method comes in, and this is the part that sounds almost too simple. Placing a vitamin D3 drop or tablet under the tongue allows it to absorb directly through the rich network of blood vessels there. This bypasses much of the digestive process and the liver's first-pass metabolism. In plain language, more of the nutrient becomes available to the body in a usable form. This approach has been used quietly for decades in certain medical contexts, but it's rarely explained to men in a way that connects the dots. Nighttime is the ideal window for this, and there's a biological reason why. Testosterone production follows a circadian rhythm. The body does much of its hormonal repair and regulation during deep sleep. When you support nutrient availability in the evening, you're working with that rhythm instead of against it. You're not forcing stimulation, you're providing raw materials and letting the body do what it already knows how to do.
Let me be very clear about something. This is not about megadoses. More is not better. Gentle, consistent support is what matters. A standard doctor-recommended dose of vitamin D3 taken sublingually in the evening is enough for most men. You place it under the tongue, let it dissolve slowly, and breathe calmly. This is not a rushed moment. It's quiet, almost meditative. The goal is absorption and relaxation, not stimulation. Over time, men often notice subtle changes first. Better warmth in the body, slightly deeper sleep, less stiffness in the morning. These are not dramatic overnight shifts, and that's a good thing. Dramatic changes usually come from stimulants, not restoration. As weeks go by, many men report improved morning confidence, not just physically, but mentally. They feel more grounded in their body. Energy feels steadier instead of spiky. There are secondary benefits that often surprise men. Vitamin D plays a role in immune regulation and inflammation reduction. Lower inflammation can mean less prostate irritation, smoother urinary flow, fewer nighttime bathroom trips. Muscle relaxation in the pelvic and lower back region improves posture and comfort. Emotional resilience improves because vitamin D receptors are active in the brain areas that regulate mood. Safety matters, and I want to address this calmly and responsibly. This approach supports health. It does not replace medical care. Men with certain conditions, such as sarcoidosis or specific calcium metabolism disorders, should speak with their physician before supplementing. Hygiene matters. Use a clean dropper or tablet. Pay attention to how your body feels, and set realistic expectations. This is not an instant fix. It's a support system. The men who benefit the most are the ones who make this effortless. Tie it to something you already do every night. Brushing your teeth, turning off the lights, saying goodnight to your partner. Some couples even turn it into a shared wind-down ritual. Not in a sexual way, but in a supportive, calming way. That matters more than people realize. I want to leave you with this thought. Aging does not mean decline. It means your body requires different inputs and different rhythms. Small habits done consistently create powerful long-term results. I encourage you to think of this as a 30-day personal experiment. No pressure, no hype, just observation. You are not chasing youth. You are supporting function. You are working with your biology, not fighting it. And that quiet confidence, that sense of being at home in your body again, is something every man deserves at every age.